A global public health emergency no one had imagined. A new virus emerging. A month after China's declaration, the World Health Organization called on countries to begin preventative measures.
I'm declaring a public health emergency of international concern over the global outbreak of novel coronavirus.
Leading from the front, the international body took the following steps. Medical and protective equipment was rolled out. Resources and experts were also deployed. Daily reports were being released and weekly briefings being held. A strong commitment to putting science and research at the heart of this pandemic's response.
Right from the start, from the first notification that we received on the 31st of December, given that this was a cluster of pneumonia, I'm a MERS specialist, so my background is in coronaviruses and in influenza, so immediately thought, given that it's a respiratory pathogen, that of course there may be human-to-human transmission. So initially when we started to put together our technical guidance for our member states, we put guidance that focused on how this virus could be transmitted. The guidance that we put up was on the 10th of January. We also shared this guidance package, which included surveillance guidance on how to find cases, laboratory guidance on how to detect cases, infection prevention and control, how to prevent infections, particularly in healthcare settings, because given our past experience with MERS and with SARS, we immediately thought that you could have transmission in healthcare facilities, you could have amplification events in healthcare facilities, and potential super spreading events. We also put out a readiness checklist at the time for countries to say, how are we prepared to deal with a pathogen, a respiratory pathogen, and what systems do we need to put in place? And we lastly put out a disease commodity package.
Despite efforts to curb infections, countries around the world continue to struggle.
This is what's killing people, not just the virus. It's underprivilege, it's lack of access. It's years and years of living with health conditions that haven't been properly managed. Because of the colour of your skin, or because of your ethnicity, or because of your social group. I know men and women who deny themselves health care so they can save money for their children if they get sick. And they know if they spend that money on themselves, they will impoverish the family. This is still a deeply unfair, deeply inequitable world, in which access to the basic human right of health is something that is given by privilege and by how much money you have. We want to change that. We can't change it overnight. We're not knights in shining armour. But behind and underneath this pandemic, COVID-19 has caused devastation, but it's equally uncovered, ripped away the bandages from a really old wound that this society has. And that is our failure to deliver equitable healthcare, a failure to recognise health as a fundamental human right. And the fact that we leave people in difficult health circumstances, sometimes decades, forgotten in the communities in which they live in, refusing to deliver them basic health care. We need to build a more secure, safe environment for our kids and everyone else to live within. Health security is not an abstract concept. Health security is about fairness, it's about equity, and older people are paying an awful price in disease, in loneliness, in isolation, and so many other things. But there are others suffering in the same way.
Now with the second and the third waves hitting the nations, vaccine access is key. WHO set up COVAX facility to ensure equity to allow for developing states the opportunity to procure the vaccine. The global north was encouraged to contribute generously to the facility, but some are not honoring their pledges. The latest challenge is the emergence of new variants of COVID-19, which must now be researched and understood. The global science community is diligently working to find solutions. The coming days will be a test as pandemic fatigue worsens, with many across the world flouting the restrictive measures and regulations.
In Individuals must play their part by taking the measures we know work to protect themselves and others. Stay at least 1 meter away from others. Clean your hands regularly. Practice respiratory etiquette and wear a mask. Avoid the 3 C's: closed spaces, crowded places, and close contact settings.
A year on, the battle against the coronavirus continue. Sophie Mokoena, SABC News, Johannesburg.